Hello everyone and welcome to the show. Today we'll be filming our first episode of VA Straight Talk with Southern Oregon Rehabilitation Center and Clinics. We're going to discuss some of the history there as it progressed from Camp White to VA Domiciliary to the VA Rehabilitation Center that it is today. Our guest today is Michael Weld. Thank you, Michael. Welcome to the show.
Thank you, Andy. I appreciate being here today.
So, as the VA moved, I think it was a camp in 1941. It was an Army base, is that correct? And then they start changing it over from there. Can you start us out from that point?
So what we think of today as Southern Oregon Rehabilitation Center and Clinic is actually the base hospital for Camp White, which was built 75 years ago in 1942. Camp White's named for Major General George White, who was the adjunct of the Oregon National Guard during the First World War. And Camp White was the boot camp, or the training ground for the 91st Division, also the 300th Combat Engineers Battalion trained at Camp White. It was known as the Alcatraz of boot camps because of the toughness of the environment. At the time, it was took up most of what we call the Agate Desert. So Camp White extended from the foothills of the Cascades all the way west to the Table Rocks, covering 77 square miles.
Wow.
At any given time, there were 40,000 men and women training at Camp White. Often it was the second largest city in Oregon at the time. And some 110,000 troops eventually made their way through Camp White during World War II.
It played a role, another role during World War II, is that correct? It was like a prisoner of war camp?
So there was a German POW camp in the northwest section of Camp White over towards Table Rocks, that's correct.
Okay. So there's a lot of rumor that there was an air base out there. I know that it took up part of Upper Table Rock. Have you heard anything about that? Can you kind of...
So there is an airstrip on top of Upper Table Rock. There's no firm documentation as to whether or not that was part of Camp White or not, but it makes a nice story.
Right, I love that story. So in '49, it kind of transitioned a little bit.
So after the war ended, the camp was actually turned over to the Department of Navy for a little while, and then from there it was turned over to what was then called the Veterans Administration. Most of the building core, part of which is now the White City Industrial Park, many of those buildings were sold. Some of them were moved to the University of Oregon, and then what we now call Southern Oregon Rehabilitation Center and Clinics was the base hospital that was converted to a domiciliary or old soldiers home there in 1949.
Okay, so 44 square miles is a pretty large area. How much of that, so how did that get transferred from, say, the military into private hands, or how did that work?
Again, most of the grounds, if you will, of Camp White were either auctioned or sold to private industry.
Okay, as a domiciliary, what was that like?
So initially the domiciliary was traditionally what we think of as an old soldiers home where veterans who had no other resources were able to come and live and be supported. So food and shelter and basic necessities. And the facility was a domiciliary in that sense from the 50s into the mid 70s or so. In 1974 was the first time in which we saw it begin to start to shift towards a rehabilitation center. So 1974 was the first substance use disorder programs or substance abuse treatment programs came into the domiciliary.
Okay, so I know a lot of people and local people in the area, people coming into the area, what we hear about is the domiciliary part of it, that it was more of an old soldiers home, that people were just coming there because they were in the military. What was that like back then? Were people able to come and just stay forever? Or
they did.
What was going on there at that time?
During that time from, again, the 50s into the 70s and even not so long ago, people would come to the domiciliary and they could stay for the rest of their lives if that's what their particular need was. It was not very structured. So at any given time, there were perhaps 1,200 people living in that facility. Treatment wasn't part of that process. It was truly a living environment. There were a lot of recreation activities, but not what we think of when we think of today in the sense of rehabilitation and treatment.
Okay, so what kind of made it transfer over? Because I know there's not a lot of domiciliaries left in the country, so this had to be one of the last programs like that, and one of the largest.
It is one of the largest. It continues to be the largest freestanding treatment facility in the country. VA SORCC is the last of the large domiciliaries, if you will, to go through what we're calling a right sizing process. And that, again, has its origins quite some time ago. So in 1984, we started with treatment teams. In 1986, they began offering true rehabilitation and treatment, mental health treatment at the facility. 1995, we started our first comprehensive primary care services. That's something that a lot of people don't realize, is that the facility does offer a full range of outpatient and residential treatment. And that started in 1995 with the first primary care programs. And then as we've progressed over time, the facility has been evaluated, and it's gone through the similar process to many of the other large domiciliaries across the country.
Okay, so when you transferred to just being a treatment, that kind of changed the state. How did that affect the population? And what's it been like making that transfer?
So that's been an interesting journey, and as I said, that started in '95 when the facility transferred over into primary care, and then we had the residential treatment facility separately. In 2005, all VA domiciliaries became converted to mental health residential rehabilitation treatment facilities, and that was 12 years ago that's occurred now. And then progressively, as the VA has learned how to do this in an appropriate way, incremental change has occurred across the facility, leading to what we now know of more commonly today as the RRTP, or the Mental Health Residential Rehabilitation Treatment Programs.
Okay, so just out of curiosity, the first thing that comes to my mind when you tell me about this transfer is, what happened to those veterans that were in there that wanted this, they were going to be there forever, because that's what a domiciliary was at first. How did the VA still continue to take care of those veterans?
And that's happened in a couple of different processes. Initially, when the facility switched from a domiciliary to an RRTP, many of the veterans that were residing in the facility at the time went on to live in state veterans homes. There's a very large state veteran home in Washington where many of the folks that were living in the facility transferred to. Some of them stayed and continued to live at the facility and start to begin to participate in the treatment programs. There came a time back in 2014, actually, where after studying the folks that were there, the VA came to understand that some of those folks were no longer safe to be in the facility, and so there was a concerted effort in 2014 to develop a program that could ensure that those folks were transitioned to the appropriate treatment environment in the community, whether that was an assisted living facility or another type of environment that was more appropriate for their needs.
Okay, so this is sort of a community partnership, taking care of our veterans where they're getting what they can at the facility, and then the community plays a part in helping them to go on to live out the rest of their lives.
This very much is a community partnership between the VA SORCC and our local Rogue Valley communities. There was, for a very long time, a perception that there was this place in White City called the Dom, and that's where veterans went, and they weren't active members of the community, if you will. Whereas now we work very closely with our community partners like Access and Revco to make sure that veterans are getting the services that they need, not only at the facility, but out as they integrate and become independent in our community and their home communities when they return home from treatment.
Okay, so at one point, not too long ago, there were maybe 400, 500, 600 veterans that were out there in the residential part of it. They came from all over the country, correct?
That's correct.
How does that work, and is that still something that's going on or will that continue to happen?
That will continue to happen. VA SORCC has long been both a local and a national resource for VA, and folks that came to us from all over the country, we still see those folks come. We still have active referral partners across the country. One of our biggest ones right now is Las Vegas. There are no residential treatment facilities in Las Vegas, so the Las Vegas VA will often ask us to provide services for veterans who normally would get their services there, and they'll come to us for a period of treatment and then return to their home VA for further outpatient and ongoing treatment.
Okay, so there's sometimes when I hear that, I'm going, okay, this is a hospital. Can you explain the differences?
So the residential treatment is not a hospital facility. So we do not have an acute care hospital at the White City facility. We never have. We depend on our local community hospitals if we should have a veteran who is in need of hospitalization or emergency services, because we don't provide those services at VA SORCC.
Okay, because when we started, you said, okay, this is where the hospital was, so that kind of leaves that impression that it's
does.
actually a hospital there when it's not really a hospital, but a rehabilitation center.
It is.
Okay, so you talked about, let's talk about 1995 when it went to comprehensive primary care services. What exactly did that mean in 1995?
In 1995, primarily that meant that we were able to open primary care clinics at the facility. Today, we call them PAC teams or patient-aligned care teams. PAC didn't exist in 1995. But we were able to offer a full range of primary care services, just like you would be able to get from your primary care doctor in the community. If a patient had a need for a specialty referral, we were able to make those specialty referrals to our sister facilities in Roseburg or Portland, across the Northwest, because again, we didn't have a hospital facility at that center.
Okay, so before I started dealing, I'm a veteran. It took me 25 years to go to the VA. Before I started working with the VA or having services at the VA, primary care didn't mean anything to me. I would just say, go to my doctor. So when you're talking about primary care services, kind of break that down a little bit to us, what that means to somebody who's never been to the hospital before.
Well, and that means exactly as you described, going to your doctor. The same way that you would go to your family doctor if you saw a doctor here in the community, if you saw someone at Asante Physician Partners or at Providence, or a doctor in private practice. VA offers those same primary care services, and for VA, primary care is a foundational services. It's one of the things we were very focused on for veterans.
Okay. There's case management came into the picture a little later on. What brought that around?
Case management really became part of the equation when we gained a greater understanding of the need for someone to be involved in a veteran's care that could help guide them through the process and ensure that treatment plans were created in such a way that the veteran was getting all the care that they need. As you know, navigating the system can be very difficult at times, not just the VA system, but navigating healthcare in any shape or form can be very difficult. And having a case manager who can assist the veterans in making sure that they understand the resources that they have available to them, the services that might be available to them, and what sort of treatment might best meet their needs. And that's where case management came from.
Okay, so back in when it first started out in 2000, 2002, that time, there was a different medical model than you're using today. I think it was more focused on what was going on than the whole health model now that we're changing to, that I understand, that's really focused on the needs of the veteran. So how did that problem model work? You know, so we get an understanding of what was going on. How did that work? And then after you're through with that, kind of take us into the transition and what made it turn over to what it's turning into today.
So in the early 2000s, particularly at VA SORCC, but across VA and in healthcare, there was a focus on discrete services, on identifying what services a patient or a veteran might need, and focusing solely on that service and not having a clear understanding of all the other impacts in a person's life that might have some impact on their treatment and their ability to gain treatment and to get the appropriate treatment, or how the psychosocial aspects of their life might impact their ability to recover from disease, if you will. So early on, again in the 2000s, things were very siloed. So case management existed as kind of a discrete silo, and social work existed as a discrete silo, and primary care was discrete, mental health was discrete. As we've gained a better understanding again of how whole health works and how a holistic approach to veteran health care is more appropriate, we've integrated those teams so that a veteran doesn't have to move from place to place to place trying to gain services from these very siloed departments. They're able to get the services that they need from a fully integrated interdisciplinary team.
Okay, so when you're saying whole health, what I'm hearing is that you're treating the whole person, not just one piece of it here, one piece here, but they all work together to better the life experience of that person.
Exactly right.
Okay, so there was, as these changes happened, and around 2008, some interesting things happened out there that I think it would be interesting, or we would like to know about. Can you kind of explain to us what was going on around that time period?
2008, 2009, the VA went through what they call the CARES process. And if you remember, the military going through the base consolidation process, where they looked at facilities and whether or not they were efficient, whether or not they were cost effective. And that process took place at the VA source, and there was a long discussion and a long evaluation about whether or not keeping the VA source open and viable was appropriate for the VA. There were a lot of folks who worked very diligently and were very strong advocates that the VA source stay open to continue to be that national resource for veterans. Not only at the local level, our congressional representatives were very involved in those discussions. And in the end, it was determined that it was more appropriate to keep the facility open. The VA source, over the 75 years of its existence as a domiciliary, as a rehabilitative treatment facility, and now as a facility that offers a full range of interdisciplinary services, has had an incredible financial and cultural impact on the Rogue Valley. And the loss of that facility would be devastating. And I think that was recognized during that time.
Okay, I know that I personally know a lot of veterans who have had service there, and a lot of them claim their life was saved by there. And these are veterans from all over the country. So I can see how it's really a national resource that we need to keep and maintain. Sometimes there's a lot of conversation about bad things, and we always get the bad parts of the news of what's going on. Recently, as you changed, coming up to today in 27, a lot of things were happening. I know that there a little downsizing went on. The way intake was going on kind of changed a little bit. Can you tell us kind of how that worked and what brought that about and where it's moving to today?
Sure. So there has been considerable change over the last 3 years. The VA source has constantly evolved and grown and improved the way that it delivers care. And over the last 3 years, there's been a very close focus on evidence-based treatments as we learn more and more about what the most effective treatments are for substance use disorder, for PTSD, for depression, and many of the mental health and symptoms that our veterans deal with every day. And as we look at that, and the more that we learn and understand, the more we know that we have to create processes to deliver that care effectively, and to deliver that care in a way that veterans want to have it delivered, and to deliver it to them in a way that produces the best possible outcomes. And so over the last year particularly, we've gone through several iterations of what our treatment programs look like, what our admission criteria looks like. And we went from having a wide open campus, which wasn't particularly focused on keeping the safest environment for veterans and the most treatment-oriented environment for veterans, to a campus which now really focuses on the ability for a veteran to step into treatment the day that they show up for admission, if they're going through residential treatment. Treatment that ensures that they're receiving both substance use disorder and mental health treatment at the same time. They're not having to go through one program and then stop and wait for several weeks in order to pick up the next program. They're receiving those services concurrently, which we know the evidence is very, very clear produces better outcomes. Okay. There was a time earlier this year where we tightened things up to the point where we realized we're missing some populations. We weren't serving everybody that we felt that we could serve effectively. And so we took another look at that early this spring and have really focused on what's the widest range of veterans that we can serve effectively in a way that is right for them, in the way that they want to have services delivered, in the way that they want to experience their services, and in a way that produces the best possible outcomes.
Okay, so when veterans come to the VA, I know that there's a wide variety of services provided there. The stays are getting longer, or used to be long, and it's even though it's not a lockdown facility, there's a lot of time spent on that facility. And I know that all that time can't be used just for treatment programs. There's got to be some recreation, there's got to be some whole health stuff going on there, some ways to change your habits and the things that you're used to doing, especially when you're going through a substance kind of program. So what is offered out there to entertain our veterans as they become better?
So there are many ancillary services that we have that go along with our more traditional substance use disorder and mental health treatment programs. We have a very robust recreation service that not only looks at how to engage veterans in recreational activities, but how to do that in such a way that may be different than the way that they used to do it before. So it's not playtime per se, but it is focused on, this is the old way that you used to engage in activity, and maybe that wasn't the healthiest way. Let us show you a healthy way to do that. We have a very robust Native American program at the facility that's often identified across the country as a best practice in residential treatment for VA. So our Native American program gets a lot of attention. Same with our vocational rehabilitation services. We have very close connections to our community for employment for veterans. And as you know, employment leads to so many other benefits for veterans and the public. We have a very robust chaplaincy service. In fact, we're the only VA facility in the country right now where chaplain residents can come and train and be certified in mental health chaplaincy or clinical pastoral chaplaincy. So there's quite a number of other things that go along with our core services that help veterans not only engage with their communities, but become connected to their communities and to look at leading a life in a much more healthy way.
Okay, so I know that it's not the, 77 square miles it used to be, and it's kind of condensed a little bit, but it's still a large property. What's on the property? Because as people go by, we see this huge military installation. That's what it looks like for a person who's never been in the military or somebody just driving down 62. Are there other things out there that are part of the property?
So the property itself now is 75 acres. And we still have the golf course. And one of the neatest things that I think exists on a property is the Camp White Museum, which is in Building 200 in that central corridor. So we have that. On the north side of the property now is a solar energy field.
Okay.
So that was recently installed and is coming online. That will produce 20% of the facility's power needs, as well as providing emergency power. So there's a great deal of other things happening on the facility other than just the residential side of the house.
All right, so, and I hear the solar panels, so something has affected the VA so that they're becoming more green. Is that what's happening?
And that is what's happening, and the VA SORCC leads in that area across VA as far as being a green facility.
Okay, that's so. we're getting a little bit short on time here, so what I would like to do is just give you an opportunity to talk a little bit about your take on the VA through this history of it, and bring us out till 2017, and then we can explore where it's going from there a little later.
The VA source has a tremendous history and a tremendous culture, and it's very important that we remember and honor that history and culture, both as a domiciliary in serving veterans that didn't have any other resources, and in its growth and evolution as a mental health and substance use disorder rehabilitation treatment facility. As we continue to move forward, we continue to get better and better at delivering the services that we're tasked to deliver to our veterans who so richly deserve them.
Okay, thank you for being here with me today. I'd like to thank Southern Oregon University for their support of RVTV Voices, Rogue Valley Community Television. You can watch RVTV Voices on Channel 15 and Channel 115 on Ashland Home Net and Channel 182 on Charter Spectrum. To find out how you can become an RVTV producer, contact Charles Douglas. Thank you to the all volunteer crew for making this show possible, and thanks to you all, the viewers, for watching. I'm Andy Draper. We'll see you the next time.